Treatment of heart failure. Treating heart failure depends on the severity of your condition and the type of heart failure you have. Early treatment can improve symptoms quickly. However, you should still get regular testing and follow up with a healthcare professional at least every 6 months. The main goal of treatment is to increase your lifespan, prevent complications, and improve your quality of life. Treatment often includes lifestyle changes and medicines. If another health condition is causing the heart to fail, treating it may reverse the heart failure. Some people with heart failure need surgery to open blocked arteries or to place a device to help the heart work better. With treatment, symptoms of heart failure may improve. Medications. Medications may treat early stages of heart failure. They can help relieve your symptoms and prevent your condition from worsening. Certain medications are prescribed to improve your heart's ability to pump blood, to reduce blood clots, to reduce your heart rate when necessary, remove excess sodium and replenish potassium level, reduce cholesterol levels, reduce adverse hormones and reactions that occur in your body that can make the heart weaker. A combination of medicines may be used to treat heart failure. The specific medicines used depends on the cause of heart failure and symptoms. Medicines to treat heart failure include angiotensin-converting enzyme inhibitors. These drugs relax blood vessels to lower blood pressure, improve blood flow, and decrease the strain on the heart. Angiotensin II receptor blockers. These drugs have many of the same benefits as angiotensin-converting enzyme inhibitors. They may be an option for people who can't tolerate ACE inhibitors. Anticoagulants. Anticoagulants, also known as blood thinners, these medications can prevent clots. Antiplatelet therapies. These include aspirin and they can also prevent clots. Beta blockers. These medicines slow the heart rate and lower blood pressure. They reduce the symptoms of heart failure and help heart work better. If you have heart failure, beta blockers may help you live longer. Diuretics. Diuretics, often called water pills. These medicines make you urinate more frequently. This helps prevent fluid buildup in your body. Diuretics also decrease fluid in the lungs, so it's easier to breathe. Some diuretics make the body lose potassium and magnesium. Your healthcare provider may recommend supplements to treat this. If you are taking a diuretic, you may have regular blood tests to check your potassium and magnesium levels. Potassium-sparing diuretics, also called aldosterone antagonists. They may help people live longer with severe heart failure and reduced ejection fraction. Digoxin. This drug, also called digitalis, helps the heart squeeze better to pump blood. It also tends to slow the heartbeat. Digoxin reduces heart failure symptoms. It may be more likely to be given to someone with a heart rhythm problem. Vasodilators. These are medications to lower blood pressure by relaxing the blood vessels. Nitroglycerin is one example. These medications can help ease chest pain. Calcium channel blockers. These can lower blood pressure and prevent arrhythmias by reducing the pumping strength of the heart and relaxing blood vessels. Cholesterol-lowering medications such as statins and other types of drugs can help reduce levels of low-density lipoprotein cholesterol in the body. Hydralazine and isosorbide dinitrate. This drug combination helps relax blood vessels. It may be added to your treatment plan if you have severe heart failure symptoms and ACE inhibitors or beta blockers have not helped. Positive inotropes. These medicines may be given by IV to people with certain types of severe heart failure who are in hospital. Positive inotropes can help the heart pump blood better and maintain blood pressure. Your healthcare provider may need to change your medicine doses frequently. You may be admitted to the hospital if you have a flare-up of the heart failure symptoms. While in the hospital, you may receive medicines to relieve your symptoms, more medicines to help your heart pump better, oxygen through a mask or smaller tubes placed in your nose. If you have severe heart failure, you may need to use supplemental oxygen for a long time. Surgery or other procedures. Surgery or other treatment to place a heart device may be recommended to treat the problem that led to heart failure. Surgery or other procedures for heart failure may include coronary bypass surgery. You may need this surgery if severely blocked arteries are causing your heart failure. The surgery involves taking a healthy blood vessels from your leg, arm or chest and connecting it below and above the blocked arteries in the heart. The new pathway improves blood flow to the heart muscle. Heart valve repair. If a damaged heart valve causing heart failure, you may recommend repairing or replacing the valve. There are many different types of heart valve repair. The type needed depends on the cause of the heart valve problems. Heart valve repair or replacement may be done as open heart or minimally invasive surgery. Implantable cardioverter defibrillator (ICD). An ICD is used to prevent complications of heart failure. It is not treatment for heart failure itself. An ICD is a device similar to pacemaker. It's implanted under the skin in the chest with wires leading through the veins and into the heart. The ICD monitors the heartbeat. If the heart starts beating at a dangerous rhythm, the ICD tries to correct the beat. If the heart stops, the device shocks it back into regular rhythm. An ICD can also work as a pacemaker and speed up a slow heartbeat. Cardiac resynchronization therapy (CRT), also called biventricular pacing. CRT is a treatment for heart failure in people whose lower heart chambers are not pumping in synchronization with each other. A device sends electrical signals to the lower heart chambers. The signals tells the chambers to squeeze in a more coordinated way. This improves the pumping of blood out of the heart. CRT may be used with an ICD. Ventricular Assisted Device (VAD). A VAD helps pump blood from the lower chamber of the heart to the rest of the body. It's also called a mechanical circulatory support device. Although a VAD can be placed in one or both lower chambers of the heart, it's usually placed in the lower left one. Your healthcare provider may recommend a VAD if you are waiting for a heart transplant. Sometimes a VAD is used as a permanent treatment for people who have heart failure but who are not good candidates for a heart transplant. Heart transplant. Some people have such severe heart failure that surgery or medicines don't help. These people may need to have their hearts replaced with a healthy donor heart. A heart transplant is not right treatment for everyone. A team of healthcare providers at a transplant center helps determine whether the procedure may be safe and beneficial for you.